Hello everyone. Yeah. Look like most of the people knows me. Somebody who doesn't know, my name is Vladimir Gashinsky. I don't have to spell it, it's spelled for me. And I'm dentist for 40 years and I do different dentistry for the past 20 years, which is holistic dentistry. What is holistic dentistry? This is a dentistry with a different point of view. Because the patient comes in here and look at your teeth, gums, joints, bones around your teeth, and I'm asking a lot of questions about your health problems, environmental, the emotional stuff. I have to evaluate everything, I have to see everything in the whole thing, because we're treating the patient, we're not treating the teeth only, we're treating the whole patient. And from my experience, I know you cannot control gum problems, teeth problems, case problem, infection problem, unless you have just underlying medical condition taken care of. The environmental issues taken care of, emotional taken care of. And I'm just going to explain to you what does it mean. If patient comes in here in the state of fear, whatever I'm going to do is not going to heal as good if patient just calm and relaxed. Very, very important to me to understand everything else. As a dentist 40 years ago, I treated the teeth, I treated the gums, I treated a lot of things, and just sometime later on we start talking about connection between the gum disease and diabetes, gum disease and a heart problem. But it's much more connection, because this is a body. This is not like arm on this side and another arm on the other side, the joint somewhere else. You can't put it all together, all interconnected. Everything in our body works together. If you have infection in your mouth, this is infection in your body. You cannot separate it. If you have a toothache, this is the same as a kidney pain. It's pain, it's a problem, and it needs to be taken care of. And when watching the video, it's interesting to come to my mind that that in dentistry is the same thing. In dentistry, we're dealing with a lot of things here. We have toxicity around our wall, but we have a toxicity in the dentistry. In the dental field, I'm just going to surprise you. We have more than 6,500 plus dental material that dentists in the United States using to deal with the dental problems. This is a big amount of this material, and they need to be evaluated in a different line. Chemicals composition is absolutely different. And that small, minor changes that make affect the patient. And this is not only this one. A lot of procedures that have been done in dentistry for years, for many, many years. Like, the silver fillings, like fluoride application, like root canals, been questioned by the holistic doctors, by the researchers, with their connection to the health issues. It's connected. And they show the big research behind it. That everybody knows that, that silver fillings, dentist knows, that silver filling contains 50% mercury. Regular consumer doesn't know. They come in and they have a silver filling stick in, and they have no idea. But dentist knows that silver filling contains 50% of mercury, 50%. And that they are still using. And almost 50% of dental offices in the United States using the silver fillings. Still. That most of the dental offices, I guarantee, and maybe there is less than 1,000 dental offices, they're using fluoride application after the cleaning for kids and adults. It's not used. And the question about root canal, very controversial, I can talk about later, but this is what is mercury filling. And the mercury filling is containing a real mercury inside. It's a powder and liquid. And sometimes this is breaks. That any dentist who places this silver filling knows that by law, this is OSHA regulation. Occupational Safety and Health Administration. You have to have a special kit. It's an amalgam removal kit. If it breaks, you have to remove it safely because it's an occupational health for the staff members. This is the reality. And I know about it, it's not secret, and I know you can't touch with your own hand. And research shows much more, and this is a big problem, and I don't understand why. Why we just still putting those fillers in your mouth? And because it's not only this one. Up to 2000, up to the recently few years, dental hygienists used to polish silver fillings that look shiny in your mouth. Not anymore. Because it's jeopardy for the dental hygienist to inhale the mercury vapor after the polishing of silver fillings. They protect dental hygienists, but patient is just small thing. Just patient sit here in the hygiene chair maybe 5, 10, 15 minutes polishing silver filling. But they're working every day. And working, every hour. And it's 8 long hours, and this is not anymore. And you know that it's as of 2009, it is a law in state of New Jersey. You have to put amalgam separator because everything is going into the water supply, and the drilled silver filling is getting in there. It's dangerous. I knew about it way before. Way before. We installed amalgam separator in 2000. As soon as it became available on the market, because I know about it. That law came later. Because, it's going to the water supply, and after that we eat fish, and after that all this interesting thing happens, and, this is no gynecologist here, but all gynecologists, obstetricians going to tell you that pregnant women don't eat fish. Don't eat fish, but it's a different topic, it's a different thing, because I can talk non-stop, hours. And what happened, that then silver film need to be removed for many reasons. It's broken, it's decayed, but you want to remove it. Every time you're touching the film with drill, it's vapor exposure. And the vapor exposure going to your lungs, going to your blood, it's going inside of your body, accumulated, and this is a problem. That we are protecting you. If you look at this picture, this is a serious stuff. That this one, patient how protected, it's a lot of things. They breathe with oxygen, they covered everything. In reality, we covered even more, but we won't show all this equipment. And the doctors and staff members protected too, because it's a lot of exposure, and we know. That for us it's important, but we know. It doesn't matter patient knows about it or not. This is our obligation, moral obligation to protect you. And this is a protocol developed by International Academy of Oral Medicine and Toxicology, and I'm certified in these procedures, and we're doing it right. Dr. Sani also has been trained in those procedures. Dr. Khanna going through the training, and we're doing it for all our patients. It's very important to us to protect you. And as I said, it's an educational event, because we want you to know what's going on. Because it's not only the air we breathe, but it's also dental office. And that's why you have to be smart enough to choose the right place to be. Because it's a very, very interesting thing going on. Material needs to be evaluated, everything needs to be just really evaluated. Because our goal to protect you from toxic environment in dental office. Okay? And then you go into the dentist, you have to ask the dentist how they make mercury-free or what they make mercury-safe. This is a big difference. Because mercury-free, the minute you stop buying silver filling from the supplier, you're mercury-free. You don't put a silver filling, you're mercury-free. But are you safe? Because safe is then you just touch it mercury. Because it's thousands and thousands of patients just around. It's just tons of silver filling in patients' mouths. And they need to be removed for any reason, as I mentioned, and need to be a safe way to remove it. It's not only all this technical thing, it's additional supplementation. It's really take a lot of knowledge to do this one, and take a lot of energy and time to deliver knowledge to the patient. Because it does not matter what they're going to say to you, what supplements you're going to take, are you going to take it or not, it depends on you. And it takes a lot of energy from us to really deliver you the message. And we're just going to do as much as we can above and beyond to deliver the message. Protect yourself. Protect yourself during this time. That the next topic is going to be very, very short. When you're taking something from your mouth, you have to put something back. And that's why we're doing the test. It's a special biocompatibility test. And this test look on the very molecular level, it's through your blood, how the material reacts to you. Are you okay with this material or not? It's important because you know that it might create a health problem. It's better to put material that is right for you, and it's give you peace of mind. It's give us peace of mind, but the most important is give peace of mind to you, that you know that you got something that's right for you. For a patient who doesn't have any health issues and you know that basically healthy, we know that 99.9% of the material that we use in the office is safe. But if a patient has immune system problems, who has a lot of allergy, this test is very, very important because you never know what's going to happen. Because you know what happens with our environment. You know that no more peanut butter and jelly in the school because it's change, life change. And this is dental material sensitivity also changes for the people. All right? And the very, very complicated topic in dentistry, it's root canal. It's a lot of talking about the root canals. And root canals is a complicated. Here you see like a one straight or two straight lines, but in reality it's like a chain. You see on X-ray on the trunks, but you can see the small micro channels. And you know that if bacteria sits inside, it's just going to silently just produce toxins. And it sits inside the microtubules, and in reality antibiotics cannot get them. And this is a big topic in dentistry, and especially a patient who has an immunocompromised system, you know, the allergic reaction. You really have to investigate this topic with them and help them to make the right decision, because everything in our body connected. I have many patients coming in and just remove one root canal can make a huge difference for the patient. But if patient wanna save their tooth and you're gonna do root canal, we're not gonna do that traditional dental office. We're gonna do root canal, but we're gonna just change it. We're gonna make it more clean. Not because you know that we're just better dentists. No. We're the same dentist trained in dental school, but after that we just took on ourselves responsibility to put something additional. You know that additional to put inside of the root canals and help it. And we're using a lot of technology. This is ozone. It's a ozone machine. It's produced medically grade ozone. Ozone is a natural gas. This is sitting inside on the top of our atmosphere and protect from UV radiation. And when you're breathing in after this thunderstorm, in reality, in medical field, it's killing bacteria, viruses, parasites, fungi, all bad guys. And we're just really working it here. We're using it in our dental offices, dental, for any procedure. Starting from the regular cleaning, to the implant placement, to the bone regeneration. A lot of things can be done with this, and it's unbelievable material tool that helps us. It's not only heals cavity-forming bacteria, disinfects root canals, tooth getting healthier, and can heal itself after this application. You know that it don't need as much difficult procedures after application of the ozone. It's very, very important for the patient. And you know that it's a lot of things here, what is just helping, but you know that it's improved, you know, this is inflammatory response, is basically infection going down. And this is something that holistic practice can bring it to you guys. You know that sometimes you don't even know that they're using it. You sit in the hygienist chair and you have your teeth clean, but the water going through this cavity machine that's spraying water. It's ozonated water. You don't even know about it. But this is ozonated water. It's not getting from the supply from outside source. No. It's just being cleaned out, and after that it's being ozonated, all bacteria clean inside and make it healthy. This is something that we know, which is we're going to deliver to you every time. You know about it and not. Because we are here for you guys. And this is what we believe. This is done for my family, this is done for my kids, this is done for my friends, this is done for everybody who's coming here. It just does not matter what patients come out here. But if the root canal needs to be removed, we have choices. We have the implants, and we have different implants. We have titanium, and we're testing those implants, and we have new type of implants, non-metal implants. This is a coin implant. It's a new state-of-the-art implant. This is starting development now, and we start using those implants. When I see some patients that have those zirconia implants in the mouth, so you know that it's good to see you guys, and we have someone to see something else. And we have a different topic in dentistry that traditional dentists don't look at this. This patient coming in and the dentistry was done many years in many different dentists in many different offices. And this is, if you look at this, is a gold crown, metal crown, mercury, and it's created a galvanic reaction. It's a galvanic reaction in your body. It's a putting physiological stress in your body. And our office is totally metal free, except a very, very small exception. But you know, any crowns, any restoration is metal free. And that's why we protect our patient from any electromagnetic stuff. Okay? And this is what we're using, you know, for you. Instead of using antibiotics and everything else, sometimes we have to use it, but mostly looking for homeopathy. Homeopathy, you know, that supplementation, it's just really natural antibiotics. And something that really improve your immune system and improve body ability to fight. And this is, we have a lot of different things. This is chemicals on the left-hand side, and this is what you use here. Because if you look at this, what is here, it's mainly herbs, supplements. It's called Q10. It's great stuff. It helps to heal your body. It doesn't harm you. And you know, this is our patient testimonials, and we're going to just play a few patient testimonials.
Hello, I'm Dan McKever, 58 years old. I first learned about Dr. G's clinic a few years ago when I was looking to remove my amalgam fillings, mercury fillings. I had a mouthful of them and had done just enough reading to know that I didn't want mercury in the mouth. So I was very impressed with the website. They talked about careful removing of amalgams. Traditional dentistry will do it, but their protocols are not as rigid as in this clinic. So I had it done with Dr. Sani. She did a marvelous job in great bedside manner, calmed me down, and everything she did came out. All the amalgams were gone. So that's important to me because I've learned through my own experience with cancer. I am a thyroid cancer survivor back when I was in my 30s. I had worked with a nutritionist as well as a traditional doctor. And I have to say the nutritionist is the one that made the cancer go away. But she would adamantly say she does not treat cancer, she treats the immune system. And she knew what supplements I needed through extensive blood work to increase my immune system. So I had that in my own background coming here, knowing that mercury fillings are not good. And I want to keep my immune system just as strong as possible so that I don't have any problems later on in life. I don't want the cancer to come back. And so I'm very appreciative of Dr. Sani, Dr. G, and everyone that I've met at this clinic. They all have a very good bedside manner. They care, and that's the biggest thing. But they're also competent. A caring, competent team is why I keep coming back here. Thank you.
Hi, my name is Jermaine Raven, and I've been a patient of Dr. G for the past 16 years. I have twins, and they were also patients of Dr. G. And I started to come to Dr. G because he was recommended by my kid's orthodontist at one time. And I loved him so much. And the reason why I loved him is that whenever he had to give you a needle, you didn't feel it. And he used baby needles, and that was like a big plus in my book. And after years of coming here, he has just straightened my teeth. I had a very bad overbite, and they are perfect right now. See? So I love them. He is absolutely the best dentist I've ever had in my entire life. and I'm 56. So that's a long time. And all I could do is recommend this practice. Very efficient practice, very good dentist, and he's a perfectionist.
And I just want to tell you that if anyone in your surroundings, anybody who you know, who you care, need the dentist, just bring it here. I promise you one thing. We're going to just care about them as much as we care about our existing patients who are here now, and we're just going to give them the safest possible dentistry technology or knowledge. Because our goal to protect you from toxins in the dental office, from toxicity, from the dental work, and this is what we do the best here. And I want to tell you what I'll start telling you, that I live in the same place as you are. I'm not living in another planet. I breathe the same air. I love fish. And sometimes fish is not good for you because it contains mercury. And you know that I go into a restaurant, I don't know what kind of food I'm ordering. Is it, you know, is it hormones there? Is it antibiotics there? Is it, you know, arsenic there? Is anything else there? I go somewhere, going to my friend's house, and I know what lawn was sprayed with. I don't know. And this is a big toxicity thing. That's why we invited Dr. Gera to talk to you about how to eliminate this toxicity, what you got in your body, how to get rid of this, and that's why we need his expertise.